Is ketogenic diet effective for managing type 2 diabetes? Type 2 diabetes is a condition that affects blood sugar control. A balanced diet and maintaining a healthy body weight are two ways to manage the condition. A ketogenic diet is a high-fat, moderate protein, very low carbohydrate diet that may aid in supporting blood sugar for some people. We'll look at the potential connections between the keto diet and diabetes in this video. The ketogenic diet severely restricts carbohydrates. The process of using fat for energy is called ketosis. Ketosis is the metabolic process of burning fat for energy. It produces ketones, which are a form of fuel. Because it helps the body to maintain glucose levels at a low but healthy level, a ketogenic diet can help some people with type 2 diabetes. In addition, lowering carbohydrate intake in the diet will help to prevent high blood sugar spikes, decreasing the need for insulin. Ketogenic diets have been found to be effective in lowering HbA1c levels, according to research published in 2018. This is the amount of glucose carried by hemoglobin in the blood over a 3-month period. Ketogenic diets may help reduce blood sugar levels. As such, some people with type 2 diabetes who also follow a ketogenic diet may be able to reduce their need for medication. However, scientists have warned that those following the ketogenic diet alongside an insulin regimen might have a higher risk of developing hypoglycemia, low blood sugar. It is best to discuss any diet changes with your doctor while on medication. Not consuming enough carbohydrates can be dangerous when taking certain medications for diabetes. Your doctor needs to monitor both blood glucose and ketone levels to make sure that the diet isn't causing any negative effects.